Well, thank you very much. Thank you for the invitation to join you in this beautiful, beautiful country. I'm originally from Scotland, from Glasgow in Scotland, and I live in Canberra in Australia. And I'm very jealous every time I come to visit colleagues in New Zealand. It is so beautiful. I do want to acknowledge the Indigenous peoples of the lands, pay respects to elders past, present, and of course emerging. I also want to give a huge thanks to Faye and team from the Health Coalition Aotearoa, and to Will and colleagues from Accenture. Sorry, I always say that wrong, apologies. My job is to, and I've put best practice in parentheses because it's very easy to speak about the commercial determinants of health and it to be incredibly overwhelming and negative. And I'm not entirely sure that I've got an awful lot of best practice to draw on. But I do really want to try and, as I say, make hope practical rather than despair convincing. I don't want us to walk out of this room to think that there isn't anything that can be done to overthrow the incredible power inequities that exist in the commercial world that is causing harm to health. So if we don't need any reminding about the scale of the problem and the cost of the problem, I had the privilege to work on the recent Lancet series on the commercial determinants of health. And I don't think anybody, oh no, that's not true. People, of course, read the whole series. But the key thing that everybody remembered was this takeaway line of four industries, the products and practices of four industries contributing to about a third of global deaths. And it's fantastic. This is a major focus, I know, for the coalition here in New Zealand, but also really importantly, which I want to take back to Australia, is the focus on infrastructure, because I'm going to speak quite a lot about governance and institutional processes that sit behind this problem. And I speak about it as this consumptogenic system. So the idea of, it's not about consumers, I am not talking about consumers. This is about the system, the web of institutions, of policies, of commercial activities, and of institutional and social norms that really have baked in this excessive production and consumption of fossil fuel goods and services that are, of course, really bad for the environment and really bad for human health, and all of which are very unequally valued and distributed. And what's at play in this consumptogenic system is the three I's: ideas, institutions, and interests. The power of ideas. Ideas are all about the paradigms, the deep, deep beliefs and values that are structuring the way we operate within society. So the power, the idea of racism, the idea of colonisation, the idea of market supremacy, the idea of neoliberalism, embedded within everyday ways of being. And those ideas enable particular interests to dominate in this consumptogenic system. It enables the interests that are about profiteering. I'm not down on profit, I'm down on profiteering. It enables the interests that are about unfettered economic growth, growth for the sake of growth. It enables the interests that benefit from racism, So those interests bubble up to dominate. And so the ideas tell those interests what to mean. And those interests shape institutions that are embedded in here. Those interests shape the rules of the game. So if institutions mean rules and norms, the power of these different ideas sitting, enforcing, enabling particular interests to dominate, then set the rules of the game. And they allow institutions such as trade liberalisation, unfettered trade liberalisation. They enable rules and norms of new public administration, which you are totally going through here in New Zealand. It enables institutions that are all about deregulation. No regulation is good regulation. So these ideas and interests and institutions are at the core of the consumptogenic system that exists today. And I just want to unpack a little bit, particularly to do with the commercial ideas, interests and institutions that are causing these problems for global health and health inequities. So I don't have time to go into all of these commercial practices, but I just want to pick up on a few of them. And these practices exist across whether it's food, whether it's alcohol, tobacco, gambling, healthcare. They're everywhere. So they're quite universal. And it's about finding the common levers, I think, that's going to make most difference to the range of different industries. I'm not going to spend time on marketing. I'm going to take it as a given that we need better regulation of marketing, because marketing and advertising is all about shaping those ideas. I've just spoken about ideas, interests and institutions. It shapes the ideas. It makes us as society think we want and need stuff. And if our politicians, if our public is saying, yes, it's good that we have this stuff, and without us even thinking about it, that dominates in the decision-making processes. It's not a surprise that the institutions that we have today are the institutions that we have today because of some of this powerful marketing. I also just want to mention some of the financialisation that's happened within the commercial world. So we think it's about big food, big alcohol, big tobacco, big tech. It absolutely is about that. But we've also got to recognise there are major interests that are sitting behind those companies, sitting behind those industries. This is some lovely work that Ben Wood and colleagues have done looking at. And really just to point towards BlackRock, we were having a good debate about BlackRock last night, and I promised Faye that I would say nothing good about them. BlackRock, Vanguard, State Street, Global Advisors and Capital Group. Massive money managers. Yep. So if you have a pension scheme, if you have a superannuation scheme, if you dabble on the share market, that's what these folks are doing as well. And they have significant shares in a number of food companies. That gives me, well, I was going to say hope. It certainly doesn't give me hope. But it tells me that there is possibilities for intervention there. Because if you are a money manager, you have a say at the AGM of these companies. And if you have a say at the AGM, that means you get to influence the behaviour, the practices of these companies. Imagine if BlackRock was convinced that investing in McDonald's or Coca-Cola wasn't a good thing to do. That would start to shift the behaviour of Coca-Cola or McDonald's. And so this is where the ethical investors that have started to emerge become important, useful for us as public health people to be at their doors. You were just talking about being at the table. We've got to be in those rooms saying, stop investing in these companies. BlackRock go out and talk about, we're not going to invest, we should not be investing in fossil fuels. We're part of the energy transition. They say, so Larry Fink, the head of BlackRock, says that publicly. BlackRock and State Street have been two of the biggest asset manager firms that have blocked the pullback on fossil fuel projects. So they're saying one thing and they're doing another. An awful lot still to be done there, but there's some possibilities. And then, of course, the reputational aspect is everything. Why do these commercial entities operate? Remember, they're about particular interests, coalitions of interests that are about maximising profit for shareholders, full stop. So if that's what they're doing, that means they have to have a social licence to operate. The social licence to operate is everything for a company. They're trying to build up their brand, it's about brand essence. They do that partly through their marketing, but they also want to be loved by the public. They want to be loved by the politicians. They want a policy and a regulatory environment that doesn't touch them. They want to be left alone. And so their reputation really matters. And I've put up a couple. Shell, I do a lot of work in planetary health equity, so we look at the energy companies. Shell on their socials speak about being, I don't know if you can read, but it says the UK is ready for cleaner energy, #powering progress. And so Shell is all about being part of powering progress, whilst at the moment they're one of the top 3 investors into new fossil fuel projects. So it's just absolute greenwashing. And then Pepsi were associating themselves and financially supporting in a positive way the access to COVID-19. They were helping provide the PPE, they were positioning themselves up on the advert, telling people how to get to the testing site. That's all about saying we're part of the solution. We're the good guys, look at us, we're helping. Some of the biggest political donations that happened during COVID-19 came from some of these commercial entities. And so the politicians love them. That's about reputational management. Sometimes it's called corporate social responsibility, sometimes it's called ESG, environment, social and governance. And we have to think very carefully, we have to look very carefully about how these are being used. Are they greenwashing? Are they whitewashing? Are they, whatever sort of washing that they're doing? Look at their financial records and it'll tell you what they're actually doing in practice. Some of them are fantastic, I'm not suggesting, but some of them are not. And then political, so corporate political activity. This is a nightmare. This is where so as part of the centre that we're running at the moment, I've invested some money in a government relations specialist to go and walk the halls of Parliament, the federal government in Australia. And it is remarkable, the lobbying, the lobbyists, you can always tell the lobbyists, they look beautiful, they have much better clothes than the public health people. But, and that's their job, quite legitimately, that's their job. But they're only registered if they come from a lobbying firm. So all of the companies, Coca-Cola, Fonterra, whatever company, they're not captured if they're lobbyists. They are operating as lobbyists, but they're not a lobbying firm in Australia. So we have no real record of the extent of lobbying that goes on in Australia. The political donations you can see, so we have a big issue with alcohol and gambling in Australia, and you can see some gorgeous analysis from Jen Lacey-Nichols and Catherine Cullerton, where they've looked at where some of so the biggest donations now coming from alcohol and gambling, and that's because there's a real public outcry, particularly about gambling in Australia, that's been building up over years about the harm from gambling, and so the companies are working really quite hard to try and quieten all of that down through these political donations. So that's just some of the commercial practices that are creating the rules of the game in the institutions, in the regulatory environment, that are elevating, ensuring that particular interests and coalitions of interests are dominating, which are completely reinforcing and maintaining those ideas of neoliberalism, etc. So how do we counter that? Every single person and every single organisation has power. In public health, we may not have the sorts of structural power, and we certainly don't have the financial, material power as some of the commercial actors. Imagine if we tried to do political donations. Maybe putting the cap around. But we do have other types of power, and I'm going to come to that in a wee second. And in 21st century governance, it is not just about government anymore. It's government plus the market, so it's the state plus the market plus civil society, all manoeuvring, juggling to inform the way in which society will go forward. So in the work that we did in this Lancet series on the commercial determinants of health, we looked at some of the types of actions that might be necessary. So, and I'm going to pick up on a few of these. So for the state actors, you can see, imagine if we had some sort of progressive action. Some regenerative business models and strategic mobilisation from civil society. So how do we create new ideas? How do we mainstream an alternative? How do we not take the premise that these old ideas, these ideational powers carry on? What about a well-being economy? What about sustainable prosperity? What about a mission economy? This is all about narrating the possibility that the economy is in service of people and the planet, not the other way round. We are not here to service the economy. The economy is simply a means to, the economy is not society. I hate listening to the conversation we talk about, all these different economies. No, it's not. It's all these different societies, and the economy is just part of it. So but it means we can't take the premise of the old idea, narrate and embed something different. And I see a little bit of that with the well-being. How do we rebalance some of those structural power inequities? Well, we need a lobbying register, and I know there's discussions about this here in New Zealand, a lobbying register, a proper lobbying register that is not just about lobbying companies. Imagine if we had a cap on political donations. Some countries do. Some countries have a cap of $3,000. In Australia, they're trying to increase the level of unmonitored political donations up to tens and tens of thousands, which is just nonsense. And then, I don't know about here, but the idea of 1 minute you're working as a minister or as a chief of staff or a senior staffer, and the next minute you're on the board of some company or some massive corporation. Imagine if we had at least a 3-year rule or a 5-year rule that you're just not allowed to do that, and that happens in some places. I'm not going to go through these. I'm going to take it as a given that we have regulation on marketing of junk food to children. I'm going to take it as a given. I know we don't, but I'm not going to suggest that you're like, these are things that we've been fighting for years. We need them. I don't. But we do also need these other things. We need to make sure that we have taxation that fully costs the harms. Why is it allowed that the private sector causes all, or some parts of the private sector, cause all of these harms, and the public purse pays for it, and the public purse doesn't recoup some of those costs? Taxation, full cost accounting would be one way to do that. I'm not going to go into any more of those because I want to get to hope at the end. Imagine if our commercial actors actually adhered to some of... So first of all, we need those regulations, the regulation of junk food marketing. But imagine then just adhering to the regulations. I do take hope in the fact that there are sustainable business models developing. So there's a whole load of cooperatives operating at more local or regional levels. There are the development of B Corps. We'll see whether they actually hold any real promise or not, but that's a move, that's a new institutional development that's starting to rupture the old business models. And there are ethical investors. There is an international network of responsible and ethical investors. Now, some people might say, well, that's just, you're still making profit. Yep. But it's a rupture to the old dominant profiteering at any cost model. So let's engage with them. It means that we need regulatory, and I'm speaking to the second point here, that we do need a regulatory environment that really supports alternatives. So we can't say, business, you've got to do all of this great stuff. Some businesses are saying, yep, we want to do this, but we're not going to be the first movers. We need a bit of a level playing field. And again, we can argue whether that's right or not, but we need to create a regulatory environment, and there's some lovely work. Christine Parker's been developing ecological regulation framework that enables some of this. And likewise for the sustainable investment. So when we're in talking to our regulatory policy and regulatory colleagues, let's help them think about what these environments could or should look like. So how can we be hopeful? There is now a language about the commercial determinants of health. Does it matter? People have been working on the commercial determinants of health forever, of course. But the fact that there's a language sometimes helps create a hook. It helps give people to hang. I was involved a lot, most of my career, in the social determinants of health. And just having a language helps create a bit of an opening for some people. So I think it's good we've got that. Globally, there will be a global report on the commercial determinants of health coming from the World Health Organization. Imagine the fights that are going on right now within WHO. The phone calls that the Director General is getting from PepsiCo, from Nestle, and I know I'm on the editorial board for the report. The fact that WHO is going to produce that report is very significant. that's a global norm, that's a new idea with some new institutional arrangements that will help keep this going. And you can hold up a global report and say, which is what we did with the WHO's Commission on the Social Determinants of Health, Australia was one of 2 countries who were vocally against that work, US being the other one. And so in Australia, we were able to stand up and say, here's a global report that says this really matters. You, Australia, are a laggard. And the politicians, of course, didn't like being a laggard and carried on doing nothing. But it gives you something to, when you don't have a national authorising environment, it can be helpful. And then my final slide is releasing the influencers. So if you don't have a political environment, an authorising political environment, and I appreciate here in New Zealand that this is quite a difficult time to address some of these issues, then this is when civil society has to be loud, loud, loud. But you can't be a single person because you get completely ostracised. You can't be a single organisation because you will get your funding stopped. You must be part of a coalition. Historical analysis tells us that it's when there are webs of influencers, webs of groups constantly speaking about these issues, constantly raising the collective consciousness, building the coalitions, pushing for the political commitment and holding those folks in decision, both in government and companies, holding them to account. That's a very big ask of civil society that is already overstretched. And this is where the sharing of resources really starts to matter. Again, we see that internationally where there's been some incredible movement taking place in national environments that are politically really challenging, is when outside voices can come and say things, or other civil society groups have resources from other countries that can help within a country. So I hope that points towards the massive opportunities for intervention to address the commercial determinants, that points towards the importance of seeing these ideas, interests and institutions at play, and that as civil society, people in positions of power, both in government, within bureaucracies, at times it's not at every point where change can happen or action gets a Guernsey, as they say. But at this point in time, looking for radical incrementalism is fantastic. It's not about radical transformation when you don't have a particularly supportive environment, but radical incrementalism is really important. Radical is the important word. That's about a small shift in power. Incrementalism is useless. That changes nothing. But radical incrementalism is the small shift in power. And when you do that through these webs of influence, that really matters. And then when the opportunity arises, you're right in there with all of the solutions that I know that all of you are working towards. So thank you.